Immunization is a key component of primary health care. It is also one of the best health investments money can buy. Vaccines are critical to the prevention and control of infectious disease outbreaks. Yet, despite tremendous progress made over the years, the World Health Organization and UNICEF warned recently of an alarming decline in the number of children receiving life-saving vaccines in Nigeria, with the real risk that complacency will undermine past achievements. On today's episode of Break It Down, we will be examining the socio-economic barriers to successful immunization programs in Nigeria, as we also focus on the novel COVID-19 vaccine. Hello and welcome to Break It Down, all matters of policies, societal issues, governance and development easily understood by all. Today we are looking at immunization in Nigeria, gains, prospects and challenges. And my guest is Chika Kemi Offor. Chika Offor is the Executive Officer, Vaccine Network for Disease Control, VNDC. VNDC is a non-profit advocacy organization that focuses on women and girls' health rights. Welcome to the show.
Thank you very much. Thank you. It's an honor to be here. Yeah. To simplify it.
Yes, to break it down.
We're breaking it down today.
You're looking so beautiful.
Thank you. And you too.
Just looking at you, I'm energized. Let's talk about vaccination. What exactly is vaccination? Let's break it down.
So let's start with the normal definition of vaccination. It's when you introduce vaccines into the body to produce immunity against diseases. Okay. That is what the textbook says. So let's break it down now.
Okay, that is why it is also called immunization. Because there are some people who will wonder why is vaccination.
They're connected. Yeah. So when the vaccines enter the body, to produce a kind of power so that diseases are prevented.
Okay, so how did vaccination start?
Vaccination?
Yes, we've been hearing vaccination, immunization for a while, for a long time, for us now, from birth. So how did it start and why?
The funny thing about vaccination is the technology and the science behind it is so amazing. You take, somebody is ill with a disease, you take that particular disease that is causing the problem, you take a portion of it, either a weakened version or a dead version of that particular disease, introduce it into the human body, with some other things of course, and then the body fights that weakened version or that dead version and builds immunity. So when the big dog comes, it can fight it. It's amazing. Can you imagine introducing the same disease into the body? But technology.
That should be scary, it's actually life-saving.
But it's life-saving.
Yeah, what are the challenges of immunization in Nigeria?
The challenges, the first important challenges of immunization is the financing. It's the financing because right now, Nigeria is not supporting immunization by themselves financially. They have the support of Gavi. Gavi provides some of the money and then the government also provides some of the money. And then Gavi cannot continually provide the money. It's not a be all end all type of arrangement. A time will come in the next few years when Gavi will say, we can no longer support Nigeria financially to buy vaccines. What will happen to the over 7 million children that need vaccines every year? So that's for me is a critical point. Where Nigeria has to prepare itself to be able to purchase vaccines for all their children.
When you say Gavi, what exactly do you mean by Gavi?
Gavi is a Global Alliance for Vaccine Initiative. Okay. So what they do, they support very vulnerable countries that cannot support the immunization programs financially. So, but Nigeria is expected that Nigeria cannot be called vulnerable by now. we're not the poorest of the poor. So what they do is they support those poor countries by providing them with the funds to purchase those vaccines that they need. And they've been supporting Nigeria for years. But guess what? It will stop one day. And then when Gavi stops providing that money, what will happen to our immunization program? So that's one. Secondly, the demand for vaccines. Our culture, a lot of people don't believe in the value of vaccines. Vaccine, the strategy for vaccine is a very peculiar one, in the sense that you are well, nothing is wrong with you, and you are going to take medicine. That is how people in the community see it. My child is not sick, my child is well, and then you take the child to the hospital, and then you inject the child. And sometimes the child might even develop a fever. There's somebody else who probably didn't take his child or her child to the health center. It's okay. Then my own child now develops a fever because they cannot see the value of vaccines. So we have to create that demand. We have to make sure that communities are not hesitant to receive vaccines. So you have one, the financial, then you have the other one, the demand. Then the third one will be sometimes the education, because sometimes you go to the health center, the caregiver takes her child to the health center to take vaccines, and then the child develops fever. And sometimes you have what they call AEFI, which is adverse effect following immunization. A few cases of that. So imagine if you're in a community and I take my child to the health center for immunization and the child becomes sick. People in the community might see it and then they may say, they're not taking my own child, they're not taking my own child. But if they're educated enough, they will realize that fever does not mean that anything will happen to the child. You understand? Just give the child paracetamol. All this kind of education are necessary to tell everybody in the community so that they are prepared for it. So those for me are the major areas.
Okay, let's look at the government now.
Yeah.
You have said that the government might not even be ready yet to be able to fund immunization, fully fund immunization. Are you in talk with government organizations?
Yes, right now, over 7 million children need vaccines. It's a whole lot of money. It's not something you can just wake up and say you want to take over. It has to be something you plan for. It has to be in the budget.
Is there a plan?
The Nigerian budget cannot even carry it. Even as we speak now, if Gavi says, you know what, I'm pulling out all my money, I'm leaving Nigeria. As I'm talking to you now, I'm leaving Nigeria. Nigeria, take over your immunization program. They can't. They can't. And that's the truth.
So what can be done? What can government do? What is your
Nigeria has to prepare for it.
If you say our budget can't even carry it, what can we do?
The budget can carry it if you want it to carry it. Okay. That's what I believe. And then private sector has to come in. It's not something that the government can do alone. I don't think the government can do it alone. But it's what they should do. Private sector has to come in to support the government in this. All hands must be on deck to make sure that this succeeds. And there has to be a plan. As we speak now, is there a plan on how the Nigerian state government and federal government can take over this when Gavi goes? Those are the questions you should be asking. Thank God I'm talking to you.
I want to ask you, is there a plan?
I don't see any plan. Because vaccine finance is a very critical point. The federal government has to take control of it. The states have to support. Which state is ready to support from their budget to come and finance vaccine? That's it. But they have to be able to internalize it and agree that it's a critical thing. Because whether we like it or not, it's coming. It is coming. Gavi cannot continue to fund your vaccine program forever. It's not possible. And then we have to realize it and start to prepare now for when Gavi will leave, maybe in the next 6 or 7 years.
Why are we talking about the challenges? Let's look at the anti-vax. we know a section of this country that resisted vaccination, immunization for the children for religious purposes. We also have anti-vax all over the world who are saying, don't give your children vaccination, don't give your... How do you deal with this? How were you able to conquer this? How were you able to overcome the one in this section of this country that resisted vaccination?
When countries like America and UK are talking about anti-vax, We're not at the same level. Vaccination is a necessary thing for our children to survive. We have challenges of water, we have different illnesses up and down the place, viruses, bacteria up and down the place. It's not the same story. People in America and abroad can say they will not vaccinate their children and nothing will happen to their children. We can't try it. We can't try it. Their lifestyle, what is available to them to keep them together, is not what is available to us. So when we talk about the anti-vax internationally, apparently they did their own. Maybe they did their own, they don't understand our situation. In Nigeria, a child must take tuberculosis vaccine.
Yeah.
You must take BCG for every child. Abroad, they may not take BCG, everybody will have tuberculosis. The environment, their health systems, it's very good. They have good health insurance, things work. We can't try it, we have to prevent. We have to prevent it. And we are a poor country. We cannot afford not to vaccinate. We cannot afford it. Our children must take BCG. Our children must take polio. Our children must take yellow fever. We even have new vaccines that are coming in. Our children must take HPV, human papilloma vaccine, to help us so that we can survive. If the traditional people are saying that vaccination causes infertility and all that, please, our job as NGOs is to tell them the truth and say it does not. All my children are vaccinated and they're not infertile. I was vaccinated. See my own. It's here. In those days, this was used to be. And I have 3 children. So of course it doesn't cause fertility.
Mine is the largest in those days.
Exactly.
In the 60s.
In the 60s.
It was like a gunshot.
Like a gunshot. Yeah. So our job as NGOs, as Nigerians, is to convince our fellow Nigerians that vaccines work. Look at what I wrote here. I said, as diseases have learned to come without cures, vaccines have learned to stop diseases through prevention. That's what vaccines do.
Prevention
they stop diseases through prevention. Tuberculosis, you don't even want to go there.
Yeah.
It is better for a child to take the tuberculosis vaccine and not have it. It is better for a child to take a pentavalent vaccine, 5-in-1 vaccine, than so that you won't have the diseases that come with it. Hepatitis has no cure, but it has a vaccine. So, I mean, these are simple things. And then ask yourself, the fatality as against the gains, they cannot be sitting in the same place. Because if you have taken hepatitis vaccine, then you don't need to go to hospital and say you have hepatitis. But when you have hepatitis, every day you'll be visiting hospital. And at the end of the day, your liver is endangered. I think they're not speaking the same thing. Vaccine is a miracle. It is a miracle. And this is an opportunity for us to access that miracle.
We'll be back. Just stay tuned. Yeah, it's still on Break It Down, and I'm still with Chika, Kemi, Offor of the VNDC.
Thank you.
So what is the VNDC doing by means of communication, reaching out to the people at the grassroots level and having them go to the right place for reliable vaccines?
Vaccine Network for Disease Control believe in community health and development for all. And the simplest way to get immunization vaccines is through the government. Because these vaccines are free. Every health center, every hospital, government hospital has vaccines and you can access them for free. But most times when you even go to the private hospital, you have to pay.
Yeah.
Right? And the good thing about the government hospitals and the government health centers is that if the vaccines are no longer viable, you just throw them away. Because they're free. They're free. So the best place for me, for anybody to access routine immunization is health center, government health centers, government hospitals. They have people that monitor to check the viability of each of the vaccines, to check the vial. And each of the vial, you see, it has green, it has colors. Colors determine whether they are still viable or not. As they start to become not viable, it's obvious in those colors. And there are people that want to immediately it's not viable, they're going to it. Because it's free. It's free to us. Your children have access to free vaccines. And the woman, the caregiver, only needs to go to the hospital 5 times. We call it the hand. Because when you go the first time, you take the BCG, the polio, and all that. Then you go the second time, you take the hepatitis, pentavalent, and all that. Then you take some vaccines come in 3 kits. If you have to go 3 times, then you go by 6 months, the child is taking vitamin A, by 9 months, taking yellow fever, measles. And the nurse cannot say you should collect money. It's not possible. You can report such a person. It's free.
Okay, you report when you take money. Because I know that in some health centers, they collect money for card, they collect money from things like stationery. So some women who really don't have money still pay something.
You report.
Okay. Report to who?
Report to NGOs like us.
Okay.
You can go to your own organization. You can report to anybody. You can set a trap. You can do survey, you can do mystery shopper, you can check. That is why every Nigerian should take this as our work. We have what we call the patient's bill of rights.
Yeah.
Every patient has a right in this country. So we in our NGO, we go to our communities and we talk to all the women, all the caregivers, the gatekeepers in the community, tell them you have rights. You can go to any health center and ask for your right. If they treat you bad, let us know. Okay. By the time they know that you know your right, the treatment changes. The choice is yours, really. This Nigeria we are talking about, let me break it down. Let me get that. Our country now.
I like it. Break it down, please.
Our country.
Yes.
I don't know where I go. Which country will take 200 million?
A lot of us are afraid.
Afraid of what?
Fear. You see, it's not in the hospital. They fear.
You're afraid. Why would fear you?
You're afraid because you don't want anybody to talk down on you. You don't want to be disrespected.
I go report you. I go shake you. By the time I shout, everybody they will arrange.
So we must learn.
Yes. So our
we must know our rights.
We must know.
No matter how poor you are.
Exactly.
No matter how disadvantaged you think you are, you must know your rights. You must know that you should not be treated badly anyway.
Anyway, and
stand up for yourself. Yeah.
And there's a law, Patient's Bill of Rights. There's a law that states that you should be treated cordially. And as they're treating you, they should tell you what they are giving you. There's a law in this country.
That's another matter altogether. I have to come back for that. You must know what you have been given.
Yes.
What is your take on the COVID-19 vaccine?
The COVID-19 vaccine is a peculiar kind of vaccine because the normal process of vaccine we talked about is taking the weakened version or the dead version of the particular disease and then working on it in such a way to make it viable so that when they introduce it to you, your system builds some form of immunity. You can fight the big dog when it comes. Yeah. But you know that the COVID vaccine is kind of different. It's a different style. It's not that same process. It's a different kind of process. That makes it a little bit easier for us. It doesn't take any deading or any weakened version of the vaccine. It uses the DNA. Or you don't go far.
Honestly, please tell us about this. Because everybody's afraid of this.
There's nothing to be afraid of. Because they've gone through, the truth of the matter is that we don't have all the information in the sense that they've done trials, but the trials is a new thing. So far, the trials have been good. But until people have started taking this vaccine for a while, before they can conclusively say it is perfect or it is not perfect. But right now, so far, so good. That's where I would hang my boots to say, so far, so good. They're going through trials. People have started administering the vaccines. Nigeria, by the grace of God, they're giving us 22 million doses, which will start from next year to administer and all that, But the truth of the matter is that, do we even have a choice? You want to catch coronavirus? They tell you, say, there's a solution to the matter.
People are afraid of the...
What are you afraid of? The COVID-19 vaccine is a blessing from my own point of view. What you should be talking about is, how are they going to share it? Before, the old vaccines are for children. Now, these vaccines are for everybody. 200 million people need this vaccine.
Yeah, I was going when do you think this vaccine we'll get to Africa. Okay, Nigeria to be specific.
We're getting elected between January and March.
And who do you think
22 million doses.
In your own private capacity? I'm not saying as an expert now because perhaps you're not, you don't have the information yet. Who do you think is likely to be eligible for this vaccine?
Yeah, so
to be
now,
the first.
The demography of it is very clear that the frontline staff should be the ones first. The frontline staff are the ones that need the vaccines immediately. The nurses, the health workers, the people in the COVID centers. Those are the ones. I don't need a genius to tell me. So right now, we're asking the government to tell us what is the sharing formula.
Okay.
No politician should take that vaccine. No politician should take that vaccine because I'm very mad. If any politician takes that vaccine. No, but they are not the frontline staff now. They're only giving us 22 million doses. We are 200 million Nigerians. 22 million is averagely about 10% of the population. So that 10%, who are they? They're the critical people. People who are the ones facing, who are the ones facing people, who are treating people with, that have this disease. So are the ones that should get it first.
So how are we going to ensure that what you are saying is done? So because given the Nigerian factor, it's most likely the first people to get it are the rich.
So, hey, no go happen like that. We're going to be asking questions. We're going to be asking a lot of questions concerning this. Who should get it first? We are asking already, the youth are asking, who are the people that should get this vaccine first? We need to know, what is the sharing formula? Are they going to share it to states? 37 states. Look at the 37 states. You don't let me finish already. In that 37 states, each state cannot even get up to 1 million. Got 22 million doses. So each state cannot even get up to 1 million. If you divide it by state already. Then in each of the states, who are the frontline workers? The nurses, health workers, all those ones. By the time you add all those ones, don't finish it. Then before, who are the next category? People who are sick, who are likely to be sick. People who have underlying ailments. Things like that. I think these are how to shift my own, but I need the government is supposed to tell us what the sharing formula will be.
Okay, let's even say the vaccine is available for everybody. Do you think Nigerians will even take it? Given the religious undertones already, people talking about Antichrist and all of that.
The thing about that one is that some people will take. And then even some people will take. To get the whole 200 million doses for Nigeria, you have. So the 22, let us start from there first. When they give us our 22 million, if we're able to finish it and people see that nobody has died, nobody has become Antichrist, and nobody has gone to hell, then I'm sure people will start to take it. Will take time. But the success of the vaccines and the fewer issues concerning the vaccine is the only way that encourage people to take those vaccines. That's the truth.
Thank you very much. We've had such an enlightening time. Such an enlightening time. Thank you very much for being on the show.
Yeah, it's an honor to be on the show. Talk about my favorite subjects.
Yeah.
Immunization, community engagement. That's what we do, and all that,
So how are you assessed? What's your contact? Because I'm sure as you're speaking, a lot of people want to reach you already as we speak.
Okay.
Already as we're on TV.
Yes. So our phone number is 0802 222 8935. The name of the NGO is Vaccine Network for Disease Control.
So if you have any complaints, you have any questions,
please call us. We'll give you more information. Information is key.
Down.
Yes, we are breaking it down. And me too.
With Chika, Kemi, Offor, Executive Officer, Vaccine Network for Disease Control, VNDC. Thank you very much for being on the show today. It's been quite an enlightening session. I really had fun today on this show.
Yes, I had fun talking about my favorite subject, vaccine, immunization. Thank you for calling us.
Thanks for watching the show. We were with Chika, Kemi, Offor, Executive Officer, Vaccine Network for Disease Control, VNDC. Thanks for watching the show this week. We'll be back same time next week. This is Break It Down.